he's quite right in identifying the issue of telephone access. And I know from my own constituents that getting through to the GP is half the battle. And once you've got through, they have usually a very positive experience once they've seen the GP or the other healthcare professionals within primary care. And we did try and help with this in the autumn of last year with the Winter Access Fund. And part of that was that practices could bid for funding to introduce cloud-based telephony systems which can transform the way appointments can be made. So we are working with GPs. NHS England and Improvement are working to drive full adoption of cloud-based telephony across the system. We're working with those practices, and I think sharing best practice of what really works. Because we're also working around the pharmacy consultation service, which has been used, again, very successfully during the pandemic, where if a patient phones 111 or indeed the GP practice, and there's a range of minor ailments that a pharmacy can deal with, face-to-face, often very quickly and very expertly, and whether that's through to sprains, through to colds and flu, and even those patients on long-term conditions, on long-term medications, such as some diabetics or those with high blood pressure, can be very well managed by pharmacists. And we want to go further with that. We want to introduce more services provided by community pharmacists, and we're in negotiations with pharmacy teams at this very moment to see if we can do that, because in Scotland and Wales they have a pharmacy first system which works extraordinarily well, and we're keen that patients in England have access to similar support as well. We're also introducing changes to the GP contract this year. Some of those are more popular than others, but just for patients in particular, one of the key elements is around extending some of those opening times to evenings and Saturday mornings to make it easier for patients to be able to see their GP if they need to. But he will be pleased to note, though, that the point he makes about housing, and again, my constituency in the South East has similar problems where housing developments are in their thousands rather than their hundreds and spring up overnight with no consultation with the local GP, who then has to take those patients on. That I am meeting with the Housing Minister this month to discuss the very issues he raises about primary care being a key feature when planning is being considered, and when things like Section 106, SIL money, is being allocated, because, as he so rightly says, the health centres need to be built first before the housing.